A 5 cross 3 centimeter left epididymal cyst in a 48-year-old male was bothering him since a long time. So, an excision was planned, a midline scrotal incision was placed, layers were dissected, testis was delivered out. After blunt dissection, some sharp dissection was done and the tunica was opened and hydrocele was identified. After this, the layers over the epididymal cyst were dissected.
Testis.
This is the testis, this is the epididymis, and this is the epididymal cyst, which appears quite big. The dissection is commenced, and using a combination of blunt and sharp dissection, the layers over the epididymal cyst are dissected out. Utmost care was taken to ensure that the cyst is not ruptured during this process. As you can see, a good assistant resulting in a good traction and counter traction is very important for a successful surgery. Bleeders were coagulated, and finally the cyst was dissected out. We were successful in removing the cyst with intact walls. After this, the hydrocele sac was everted and closure was done. We closed the skin using subcuticular stitches. No drain was placed as there was not much bleeding, and a scrotal bandage was applied. Patient was discharged the next day. Thank you.